With that, we're moving on to our third speaker for the day, who is Jaclyn Schess. She is a pre-doctoral research fellow at the University of Michigan and also the founder and president of Generation Mental Health. She will be talking to us about an interesting qualitative study on alcohol dependency and economic outcomes. Over to you, Jaclyn.
Hi. All right, can you hear me?
Yes, yeah. Loud and clear.
Okay. We can. Great. Okay, wonderful. All right, hi everyone. So I first just want to thank all the previous presenters for their insight. I think the points that have been made so far have been really helpful, and I just want to pick up on a point that's been made so far that my experience working in different meetings, particularly at different mental health research centers, has really been that the culture is set at the top, and that if we want to encourage people to take care of themselves while they're trying to look out for others, is that the leadership, and that's down to individual supervisors, have to be the ones to set the tone and say that it's okay to look after yourself. And I've had very different experiences with different types of supervisors in many different settings. And I think, Purna really made incredible points that really stuck out to me. And, it's awesome to see that at GBL, you all are taking that so seriously. So with that, I'll move on to a very different topic. I'm excited to be able to be here to talk a bit about substance use disorders, particularly alcohol dependence, in the context of worker well-being. We conducted a study in Goa, and I worked with some co-authors at Sangath Community NGO, so I just want to give a shout out to them. And we had some funding from Grand Challenges Canada, so I also want to acknowledge their help with this study. So we can move on to the next slide. Alcohol use disorders are on a spectrum. And that means that when we talk about alcohol use, we're talking from hazardous use all the way through till dependence, where dependence is characterized by cravings for alcohol and increased tolerance, where that means that you need more of the substance in order to feel the euphoria from that. And then physical or psychological withdrawal from not having intake of alcohol. And 2.7% of the Indian population has alcohol dependence, which is a very high number considering that 50% or so of the Indian population is abstinent from alcohol. We also know from observational studies that alcohol use disorders are associated with lower individual and family income, with unemployment, with workplace problems, and with higher debt. So all of these studies give us these individual correlational data points, but what we wanted to understand was how do all of these factors interact? And particularly, is there perhaps what we would think of in development economics as a poverty trap, or a self-reinforcing dynamic causing poverty to persist due to alcohol dependence? And we were particularly excited about getting to explore this topic with qualitative data, given that qualitative data gives us the ability to dig into some of the nuances and the mechanisms behind these ideas. So if you move on to the next slide. So we were working with data from a bigger project, which was a randomized controlled trial for the development of a treatment protocol developed in Goa, where the idea was to develop a home-based de-addiction protocol for alcohol dependence. Alcohol dependence has very high relapse rates, has very low treatment rates to begin with in India. People don't seek out treatments. There's very low availability of treatment, and so Ungath went through the process of trying to develop this de-addiction protocol. And through that work, they did qualitative interviews to understand from a range of different stakeholders whether or not this would be acceptable and feasible. And so that's where we get our sample from, is these formative interviews, which asked a range of different questions about the experience of alcohol dependence and their previous treatment experiences, with 11 men with dependence, particularly men, because the incidence of alcohol use disorder in women in India is very low, 12 family members, and 13 doctors from primary care settings where they might interact with some people with alcohol use disorder. So we can move to the next slide. So the first thing that comes out of the data is this idea of excessive spending and increased debt. So we see first that there's this increased spending on liquor or alcohol. We see from a man with dependence, he wants to save for his future, home, marriage, but spends all of his money on alcohol and can't save. So that's really important. Both increased spending, but also lack of savings. Those two things might go together, but we want to see that they are talking about the fact that they're interacting. Also, family members reflecting on the fact that the household is not bringing in any money. They're not getting any money into the household because the male is spending all of their money on liquor. This last quote, I think, is really important to reflect on, because we see that the family members are trying their best to take care of those with alcohol dependence in their households. And in doing that, they're actually going into debt to try to get treatment. So they're saying one problem is the spending on the alcohol. The other is that we have to try to afford their treatment. And both of those mean excessive spending and debt. So that puts our households in our sample into this decreased wealth position. And that means we're looking at a situation of possible poverty. But now the question is, do these households stay in that position when we're thinking about whether or not this is a trap? So if we move on to the next slide. So the important thing to think about here is, okay, they're spending what they're getting, but where's the income coming in from? Are they in a situation of being able to get income? What we learned is that alcohol has a serious interference when, specifically for people with alcohol dependence, with their ability to sustain work, to stay in employment. So we see that the first person reflects that they feel tired, they can't get up, and particularly this person looking at more of a casual employment, the job's gone if they can't show up for their job. The next person talking more about a professional sector job, can't concentrate on the finer nuances, can't go to the office, can't take the next logical step. Then the other side of this is that during unemployment, boredom winds up being a stressor and winds up increasing the alcohol intake. So you have this cycle of unemployment and increased drinking, which means that not only are our households winding up in poverty, they therefore can't get out of that by finding employment. So we can move on to the next slide. So the last key in this that comes out of the data is, okay, we have, this situation economically, but maybe people might be able to get out of that by seeking treatment, by, remitting out of alcohol dependence, both naturally or through treatment. But the state of treatment that is reflected on is really poor. So we see that there's an incredible lack of resources in the PHCs. They reflect on the fact that they can treat symptomatically, so people will come in with symptoms, maybe gastritis, but they can't treat for alcohol dependence. It requires counseling and a de-addiction program medically, and they can't do it at the PHCs. Also, this has been reflected on before, right? There's a ton of stigma towards patients. It's particularly acute for addiction because doctors see it as a choice. So we see this, whatever problem he has, he chose it for himself. And so the doctors would rather treat other disorders. And we saw this from a number of doctors. So that's a huge problem for people with alcohol use disorders that have a real disease. So this means that when we put all of this together, we have a situation where people are winding up spending in debt, having trouble in employment, and then can't get out of their situation because there's not treatment that can really help them get out of it. So this is what we've learned from our data, and the next steps would be trying to test this quantitatively. So trying to look at whether or not this can hold up to snuff with some quantitative testing. So thank you so much for listening. My references are on the next slide, but I'm happy to take questions.
Awesome. Thank you so much, Jaclyn. I think it's mental health is such a vast topic, and alcohol dependence or substance disorder forms a very important part of it. I think when you shared your slides, we did a little bit of our own research, and apparently there are more than 10 million cases on alcohol dependence registered in India alone, which just goes on to talk about the severity of the issue. I would now like to open the floor for questions. So if you guys can please follow the protocol, raise your hand or text in the question on the chat box. Okay, cool. We have 2 hands raised. Piyush, if you can please take the first step.
Hello, can you hear me?
Yes.
Okay, so I wanted to know that in countries like India, the access or availability of treatments for such disorders is very limited. But what do you think a low-income country with limited resources can do to tackle such issues?
Sure. So I think we have to kind of step even farther back than what I've talked about and think about prevention. So I'm actually writing a huge paper on where we've comprehensively reviewed alcohol policy in India, and whether or not it's realistic to think about policy change, we have to start pushing for policy change in India because that's the first step to looking at a change in the prevalence of alcohol use disorders is prevention. And a lot of that prevention can happen on the population level through policy change. Because the way that alcohol is controlled in India basically makes it, makes it pretty easy for people. What we see is that when people drink, the frequency of alcohol use disorders is much higher in India than in other countries, which tells us that there's something about the way that people drink, how they understand their relationship with alcohol, what we can do about educating the population about how to understand what a drink is, what's in alcohol, all of that, right? So there's both policy level, but also education. And even, right, I talked about this idea of the spectrum of alcohol use disorders. There's so much that needs to be done on the hazardous use and harmful use to make sure that people don't progress to the dependency. And all of this can then be done if we talk about community level interventions. There's a lot of development on the end of using community health workers, lay health workers, as well as technology. So there's a lot of work on, I talked before about, doing home-based de-addiction, using lay health workers to do the psychoeducation part of the interventions. And that way, if we think about mobilizing the same way we have with other mental disorders, there's a really bright future in terms of being able to treat these disorders. But we have to also take a step back and think about the fact that substance use disorders are chronic relapsing disorders, and the rest of the world hasn't necessarily figured out the best way. These are challenging disorders no matter what. It's going to take focus and investment for us to really tackle this issue around the world. Hopefully that answers your question. It's a long-winded answer.
Yeah, it does. Thank you.
Of course.
Okay, amazing. We have another question from Arvind. So Arvind, could you please ask your question?
Hi. So I saw that you carried out an extensive interview with many subjects. How did you establish trust with your subject to get these insight? Like, because even we do similar kind of research, qualitative research, in-depth interviews, and it becomes difficult to break that barrier between researcher and the subject. So how did you handle it?
Sure. So I have to, give the caveat that my role in this research has just been working with the data that's already been collected. But what I know about the way that Sangath collects data and the way that our researchers work in the field is that what's been good about working with Sangath and their researchers is that people know this organization, they've been established for a while, and so the researchers are people that people in the community know. So it's a kind of building up of trust over years, honestly. So there's a kind of established understanding of who this organization is. But then I think it's just, once people, particularly the family members, they really want help for their family. The people who we're interacting with are people who are joining on or who understand that we're trying to develop a treatment. So they're invested in that idea, and so they want to be able to help that. So that's kind of why they want to, be part of the project. There's obviously always challenges with developing trust with participants, and I, have seen that with other projects. This particular project I wasn't on the ground for. I don't think there's a clear answer to that. I think there's always challenges with developing trust with your participants, but you just do your best to have have community presence and train, and the organization trains the researchers to, kind of to explain the project as well as possible so that people know what they're getting into. So I think that's what it is.
Yeah. Thank you.
Yeah, of course.
Okay, thanks Arvind, and thanks Jaclyn. This has been great.